can I acknowledge the Wurundjeri people, the Kulin Nation, and recognise that we are now having ceremonies and having gatherings on land where ceremonies have been held for thousands of generations. This is a special place. I want to acknowledge any First Nations people in the room and give them my absolute solidarity. I also want to acknowledge HIV's long-term survivors, the men and women who are fighting every day to get the best quality of life that they absolutely deserve. I want to acknowledge the Minister. Thank you for being here. In the early days, it wasn't easy to get ministers to come to our meetings. Now we're going to beat them off with a stick. Sorry, I didn't mean that to you. I'd like to thank Lady Potter for standing by us for all these years. You have been a stalwart, and I thank you. I also want to acknowledge, and it's been happening to me all night, I've been hearing voices and seeing photos of people, and all I can think of is the spirits that are sitting up there in the balcony watching us. And I'm sure there's a mixture of pride and sadness, but overall joy about how far we've come since that night at the Laird. What do we expect to accomplish? Well, believe it or not, at the very start of the epidemic, we had meetings of people from every state and territory, and we had a serious discussion one afternoon about whether the gay community would survive at all, anybody. Whether we would all, in fact, be identified, locked up on islands like old leper colonies, and that our community institutions would be destroyed and we would be no more. Mercifully, we found ourselves finding out what empowerment means, and we learnt to empower ourselves. Now, I don't think anybody can ever underestimate that powering, because what we did was, by helping somebody else, they helped us. And over time, the networks built, the trust built, and it became... I remember a couple of people saying to me that VAC was a place where they felt the safest, where they could go and be with the friends who they knew and who they loved. VAC was a place where they felt useful and recognised and acknowledged for the good work that they were doing. When we started, we had 3 key aims, and I've gone back to first principles here. I've read one of Adam Carr's speeches, which one day should be in the National Library. He said, "We will care for the sick, we will comfort the grieving, and we will educate those who don't know yet." And those 3 aims are still with us today. I wanted to... Thank you. I hope you people over there can see me. I feel like the Queen at the White House. Anyway, I want to mention some of the foundation people I met and lost, and what a role they played in establishing what is now such a strong and vibrant and skilled organisation. Peter Knight, without whom we would never have had care teams and support. The irony, of course, was that he was one of the first people to actually need a care team. My co-worker at the health department, Ian Goller, without whom... Yeah, thank you. Ian deserves to be remembered. He was such a quiet, lovely man. But without him, we wouldn't have the foundations of an education strategy. Now, we wouldn't have the latest news from San Francisco, and we wouldn't have the start of some of those most amazing education prevention initiatives that I've seen anywhere in the world. Keith Harbour, dear old Keith, he used to go through airport security in his full leather with all his various piercings, and he took the time to explain what leather was all about and what he was doing, which was basically travelling around the country and helping to organise people living with HIV/AIDS into groups and helping them to find their voice. It started in Hobart at the third national conference, but Keith followed up and made, once again, another vibrant national organisation, which is hard to do when a lot of people in the meeting you know are going to die. I want to acknowledge Chris Carter. He worked for Don Chipp and the Democrats. He was on our original committee. And because of his connection to Don Chipp and Neil Blewett needing Don Chipp's vote in the Senate, we suddenly got in front of Neil Blewett and told him what we wanted. And he was very grateful to hear it. So thank you, Chris. I want to acknowledge Lee Holloway, who built fundraising. It's not glamorous, it's not, well, this is, but back then it wasn't. It was shaking cans at bars and doing things like that. Well, Lee built fundraising up into the proper status that it should have for community-based organisations. And I want to thank somebody who's also not here, but was a dear friend, a name of Noni Holmes, which most of you wouldn't know, but Noni worked as the Occupational Health and Safety Advisor for the Australian Council of Trade Unions. And because of her work, Australia had the first national union health and safety policy signed off by Cliff Dolan, of all people. So that sort of quiet work behind the scenes done by allies was incredibly valuable. I also want to acknowledge Peter Charlton, the first openly HIV positive employee of VAC GMHC, a man who showed us by his everyday example just what it meant to live with zest and passion and determination. Now, just quickly, because I know you all want to start dancing, so do I, some people who are still with us, and I hope they hear this at some stage. There's a guy called Dr. David Plummer, who some people will know, most people won't. But if it wasn't for David's absolute determination, we would not have clinical services today. He wanted, and so did I, to have a lasting legacy of services that could help people. And we naively thought, once AIDS is gone, we wanted something to be there. Well, AIDS hasn't gone, but something beautiful is there. I want to acknowledge probably my oldest and dearest friend, who's unfortunately not here tonight. His name's Adam Carr. Now, if you know, you know. Adam wrote for Outrage magazine and put into simple words the complexities of what we were facing. But it wasn't just a medical explanation. He was very clear about political organisation too, because it's all well and good to have all the data in the world, but you've got to have political will to carry that data through to concrete actions. I want to thank the wonderful Bill O'Loughlin, who has given me pep talks and had a shoulder for me to cry on when things got too much. When we had 2 or 3 other funerals a fortnight, when you got another phone call and somebody else had just died, or somebody else had just found out they were positive, or somebody else was in hospital for the first time. They happened out of the blue. You never knew when the phone rang what it was going to be about. It was terrifying. I have to acknowledge Elizabeth Reed. I think we owe her a huge debt. She was employed by Dr. Blewett, to write Australia's first national AIDS strategy, which we got out in about 1998, I think it was. America got theirs out in 2013. Elizabeth did the hard yards, and she was a philosopher. She wasn't a public health expert, she was a philosopher. So everything got cut and talked and argued until we had the essence of what we needed to say. And finally, but not last, we were extraordinarily lucky to have a health minister like Dr. Neil Blewett. He's the best health minister I've seen in 40 years. I suppose the worst I've seen was Peter Dutton, but anyway. But ministers can only be as good as their advisors. And luckily, Bill Botel, who was an old university friend of mine, was Neil's advisor. And Bill took Neil to San Francisco, took him to New York, took him to London, where we were looked down upon as colonials. And he came back and decided the San Francisco model was the best one to try and emulate. So he did, but we made it the Australian model. So what was the key? We empowered ourselves. We engaged ourselves in community organising, in community development. It's no good having boards with lots of money and lovely fancy buildings, although the Pride Centre is beautiful. It only exists because of the people, because of the heartbeat. And by having those volunteers and members working so hard, we built foundations that have lasted to this day, and I believe will last for decades to come, long after we're all gone, maybe. But the key point was, as they said at the National Conference in Hobart, nothing about us without us. And that's still true. Our other key, because we had connections with our community, was we could get good data. We actually knew what was happening. We knew there was a cohort of gay men out in the suburbs who didn't go to the Laird or Pokies or whatever, who didn't pick up the gay press. We had to find ways to get to them. And that means turning good data into good action, which I'm sure Professor Sutton would know all about. And thank you. We needed to have distance from government, but we also needed to be in there with the ministers saying, look, you should do this, you should do that. There were lovely moments when I was working in the Victorian Health Department, and I was upstairs with the minister on the 20th floor, and downstairs was ACT UP, banging on the windows, scaring the shit out of public servants. And good on them. Because by talking to the minister and saying, look, we could do this, this and this, and they'd be happy with that. Oh, would they? Oh, good, I'll sign it now. And that was ACT UP's demands. So you need pressure from the outside, but you need people inside working as well. How are we? I was asked a series of questions to answer, and I wrote these notes on the plane coming down from Brisbane, because there are so many stories to tell. How are we today? I'll repeat what was said earlier. The epidemic is not over. Today, somewhere in the world, 1,800 people became HIV positive. It might not be Victoria, it might not be Australia, but somewhere in the world there are people who still desperately need access to PrEP and access to antiretrovirals and access to care and doctors and a place where they can go and feel safe. We have concrete assets today that belong to our community. I mean, 40 years ago, if you had have said that'd be the case, the only thing we had back then were the gay newspapers. And they were hanging on, as Bill Calder will know, by a thread. But now we've got established, set and magnificent facilities and services and amazingly well-trained professionals and carers. We've won a hard-won place in our society. Now we need to harness our full, multifaceted, beautiful variety and potential. Can I ask everybody to fill your glasses? I want to finish with something that I usually do at these sort of gatherings. I want to propose a toast. The toast is to absent friends. Thank you.